Good morning, everyone. It is March the 14th, 2026. I've always talked about things where we haven't got enough support workers and to help the homeless and that. And there's reasons behind that because of our own healthcare system that's been sort of falling apart. It was actually falling apart even before the pandemic, and we didn't have enough people, like older physicians were retiring, and there was starting to be some burnout as well because there was more patients, and as they retired too, they were leaving open spaces that there was no doctor for people, as well as the other big one was that it's interesting because things have gone in reverse right now because prior to the pandemic, we train our physicians and our nurses and that up here, of course, in Canada. But one of our biggest problems is that after they get trained, the United States was taking them for their private clinics and stuff like that, and they were getting well paid, probably better pay than what we were giving them here. So they were being enticed down to the United States to work. Now, with their healthcare system collapsing in the States, now the situation is starting to reverse itself in the fact that we're seeing, because of the high insurance premiums and that in the States, and people can't afford it, and the public system, they're defunding everything in the healthcare system. They're totally dismantling it, where we're not trying to dismantle ours, but we're just trying to get enough workers to work in the system to get it up and really running. So what's happening now is the provinces and the government and that is recruiting our workers from the States now in healthcare up into Canada. So there's this is what the video is going to be that I'm going to put up on the reversal here. And there's more incentives for the nurses and the doctors now to come up here. And of course, our healthcare workers that were enticed down there would most likely have their Canadian citizenship, so it was much easier for them to get back up here to Canada as well. And what they're doing now is with the immigration system that's sort of out of whack and cutting back on immigration coming into the country right now. The workers that are coming in, the skilled workers now, are getting fast-tracked. And of course, they have medical experience in that, but they're fast-tracking them into programs where they can complete their certificates and that to be able to be licensed to work here in Canada. So I'm going to put up this video on it, and I think it's very interesting to see what's happening right now because everything is so unstable down in the States, even further than, like, we're unstable up to a certain point too, but it's looking worse in the States now than it is here in Canada. So people are coming up here to work. So it's just an interesting trend to see how far this goes. And so I'm going to put it up, and I hope everyone enjoys watching this video as well. Okay, take care, be safe, watch your surroundings, and we'll talk again soon. And bye-bye.